Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Lauren Papanos and Romana Brennan.
Hello, everyone, and welcome to Nourish MD. I'm one of your hosts, Lauren Papanos, also joined today with Romana Brennan. We are going to be talking about men's health and prostate health specifically, and nutrition and supplemental and some lifestyle strategies that can help support better prostate health. So just as a brief intro, we chatted with Dr. Van Meter a couple weeks ago just about overall what to know about prostate screening, about overall prostate health. But just as a recap, if you didn't have a chance to listen to that episode, the prostate is something that all men have, and it's about a walnut-sized gland that's surrounding the urethra. And some of the common prostate problems that we'll talk about today are just going to be overall inflammation of the prostate that can lead to different types of prostate-specific conditions. And so we'll go into some of the anti-inflammatory specific strategies within diet and supplementation for those types of conditions that are inflammatory in nature within the prostate. And then the other one that we'll touch on is what's called BPH, which is benign prostatic hyperplasia. And we'll talk about some of the differences within that. We'll also talk a little bit about if you're maybe having more of like an immune system involvement that's affecting the prostate, some of the things that we can do to be able to support our immune function that are more prostate specific. So Ro, why don't you tell us a little bit about some of the nutrition pieces that we really want to both debunk and also really highlight for men that are maybe dealing with prostate health issues?
So when it comes to especially BPH, this benign prostatic hyperplasia, one of the symptoms that men might be experiencing if they are struggling with this is more frequent urination, having to get up in the middle of the night to go to the bathroom, which can be a very annoying symptom, can disturb your sleep, which can have other health repercussions. So a lot of individuals might be tempted to just decrease their water intake to not have to go to the bathroom as frequently. However, making sure that you're well hydrated is so important, not only for cellular health, but also for bladder health as well. We don't want to be dehydrated, as that can also lead to UTIs, which is a different type of issue that we covered in our urinary health episode that we're not going to touch on today. But just something to note, if you are someone who struggles with frequent UTIs, be sure to listen to that episode. But just highlighting the overall importance of hydration is so critical, also to help lower inflammation. Lauren, you already had mentioned how inflammation really serves as kind of the foundation for any of these prostate issues, just because by nature, the prostate gland can be very vulnerable to inflammation because of how it's surrounding the urethra. If it's enlarged or inflamed, it can actually essentially constrict the urethra and affect kind of the control that we're able to have over our urination. So that's just a little bit more in terms of what's actually happening. But again, going back to the fact that hydration is so key, we need to make sure that not only are we drinking enough water, but that when we are hydrating, we're actually hydrating our cells effectively. So you might notice, okay, I'm drinking a lot of water, my urine is clear. You can kind of use the color scale as a helpful reference in terms of how hydrated you are, unless you're taking B vitamins. Those can make your urine very bright yellow. But we want to see your urine be kind of like a pale lemonade type color. If it's dark, looking more like apple juice, that's a concern. If it's completely clear, then we might need a little bit of additional mineral support, electrolyte support, something along those lines. And implementing something like electrolytes, we get that balance of sodium and potassium. It actually helps these water molecules enter your cells more effectively, making us better hydrated as opposed to just drinking water. And then you might notice, I'm drinking a ton of water and urinating immediately and it's clear. So at that point in time, we might need to implement some what we might call rehydration support, where you're actually getting that water into your cells as opposed to just flushing through you. So again, the solution is not decreasing your water intake if you are going to the bathroom frequently. Another thing that you'll want to consider is, are you having diuretics? Some of us might have heart issues where we're actually taking a medication that is a diuretic. So it's something to be aware of if that is something you're struggling with. Something else that can have a diuretic effect is caffeine. So consider your coffee intake, caffeinated tea consumption. Just notice, am I going overboard with the coffee? Am I having 5 cups a day and noticing that I have to go to the bathroom pretty immediately? Can we modulate your caffeine intake in order for you to have less frequent urination? Because that might be aggravating the situation. So just something to be aware of when it comes to hydration, making sure that you are well hydrated, that we're not just decreasing water intake if we are having frequent urination.
Yeah, those are all really good points. And another thing that we talked about was like the role of inflammation. And we have a whole podcast series on anti-inflammatory strategies. And this is the one where we also interviewed Dr. Boz, who's a rheumatologist, to talk about more chronic inflammatory conditions and things. But we also talk quite a bit about nutrition and supplemental strategies for inflammation. So all of those recommendations apply because, as Romana mentioned, the prostate is very susceptible to inflammation. So we want to be looking at how we can reduce overall inflammation in the body. So just as a recap, if you haven't listened to that episode, antioxidant-rich foods, things that are rich in polyphenols and anthocyanins, like what you get in dark leafy greens, berries, green tea, are going to be incredibly important. Making sure that we're getting enough omega-3 fatty acids and not too much omega-6 fatty acids, making sure that ratio is staying properly balanced by consuming enough of your fatty fishes like salmon and sardines, likely also looking at supplementation, as I would say 99% of people aren't able to get in enough omega-3s through just diet alone and need some supplemental support. Just making sure that that supplement support you're using is really high quality, and that we're also being really mindful of omega-6s, which are what are mainly found in vegetable-based oils, as well as things that are high in soy and corn. Vegetable oils would include things like canola oil, safflower oil, sunflower oil, really anything except for your animal-based fats or things like avocado and olive. Technically, olive is a vegetable-based oil, but it has a different fatty acid profile, and that's really what we're after when it comes to reducing omega-6s. Outside of that, cruciferous vegetables are another very helpful strategy. There are enzymes in the cruciferous vegetables, and broccoli in particular, that are both great for women's health as it relates to things like ovarian support, but also men's health as it relates to things like prostate support. So those are going to be things like broccoli sprouts especially. And then you also have a little bit less potent enzymatically, but also cruciferous options, which would be things like kale, cabbage, cauliflower, and so forth. We want to make sure that we're really being mindful of our blood sugar control, as a high blood sugar state causes inflammation in the body. So if you've got high blood sugar or high A1C, A1C is creeping up above 5.2, we've got a little bit of work to do to get your blood sugar into better control, because there could be a situation where just your overall, not so much the nutrients you're eating, but more so how you're pairing foods together and things is causing an inflammatory response in the body. So that's something for us to take a look at. And we can determine a lot of this just by looking at your labs to see where you might need a little bit more support. And then just being really mindful of situations that cause a chronic cortisol response. Cortisol is that main stress hormone. Our body releases it when we're in fight or flight mode. In the acute setting, our body uses it. It's anti-inflammatory for us. It's great. In the chronic setting, where we're constantly in fight or flight mode, that's what can be really problematic for inflammation levels. So, if we're having troubles with like sleeping, that's going to go into the bigger picture of managing our overall inflammation, managing even our blood sugar control. So we really want to hone in on inflammation. And again, we have tons more resources for you on some of those anti-inflammatory strategies in those podcast episodes from a couple months back on inflammation.
Enjoy high-quality supplements shipped right to your door with full script through Private Physicians Medical Associates, PPMA. Reap the health benefits of pharmaceutical-grade vitamins while saving 5% on all orders. Set up your free PPMA account today. Visit privatemds.com.
Let's talk a little bit about some of the other types of support strategies. We want to touch a little bit on some supplemental things and then also some lifestyle strategies. So, Romana, what are some herbal and like supplemental things that we can look at utilizing for prostate support?
Yeah, so one of the very popular herbs for, I would say, men's health in general. So it might ring a bell as saw palmetto. But saw palmetto is an herb that has been shown to help support prostate health. And it can support this because it helps lower what is called DHT, which is a downstream metabolite of testosterone. When we're younger in age, having higher DHT can be helpful for prostate development, but when DHT is higher as we're getting older, it can lead to some of these prostate problems. A lot of our patients are monitored for PSA, which can be a screening tool for prostate cancer, which we talked about with Dr. Van Meter. Just something to note that there are different lab markers that we're happy to discuss in our one-on-one sessions. Definitely consider nutrition consultation. If you're unsure of what your labs mean and how this might impact your health in different ways. But yes, so bringing it back to saw palmetto can be helpful for BPH, that enlargement of the prostate. Some other ones, stinging nettle root as well as white sage have been shown as well to be effective. There are a lot of complexes, so herbal supplements that combine a variety of these herbs, or we can use these in isolation to be supportive.
Yeah, and stinging nettle is also, they're all options you can drink as like teas and beverages and such, but stinging nettle is personally one of my favorites, has a very nice, refreshing, earthy taste. So if you don't want to go the capsulated route, these are always options that you can do in teas as well. Just be mindful that stinging nettle is a diuretic. And we talked about if you're having a lot of frequent urination and that's causing you to not drink as much water, you might want to be cautious with those diuretics. But outside of that, which I think are all really great strategies, I think saw palmetto is probably one of the best ones or one of the top options, right, for prostate function. But just overall inflammation support too, because we talked about the role of inflammation and prostate inflammation. So making sure that we have maybe some omega-3 supplementation, maybe also looking at things like curcuminoids or turmeric, which is usually how it's sold. Those are also really great anti-inflammatories. Ginger can be one. And then we also have some herbal options that are anti-inflammatories that are especially specific to the prostate in general. Cleavers are one that are great. They're great for the lymphatic system as well. They're great for the prostate. We have other ones like marshmallow root, black cohosh, wintergreen, cranberry. Cranberry is probably one of the other foods and also supplemental things that gets a lot of press for its support for the prostate. So again, like I mentioned, it is an antioxidant. So you're getting some of that polyphenol, some of that anti-inflammatory support. So those are some things to look at: cleavers, corn silk, marshmallow root, black cohosh, kava, cranberry, uva ursi, wintergreen. All of these are kind of like prostate specific herbal support options.
There's a variety of different symptoms that we already discussed with Dr. Van Meter that can be implicated with prostate issues, whether it's more so on the pain side of things or more so on this inflammatory side of things. But our immune system can be involved, especially if it's the case of more of a bacterial infection that's causing this inflammation of the prostate. So we'll also want to consider some immune support herbs that can help modulate, regulate the immune system, whether that is something like an adaptogen, like ginseng or reishi, cordyceps, some of those functional mushrooms that you might have heard of, but really making sure that we're supporting the immune system, especially if this is more of an immune mediated issue. So making sure that we're also supporting the immune system. If you're noticing that maybe your immune system is being activated in other ways as well, it's not just manifesting in this prostate pain, which we would call, whether it's bacterial prostatitis or non-bacterial prostatitis. These can both be challenges that might involve more of the immune system as opposed to inflammation from more of a systemic or whole body perspective, which we might see more often in the case of BPH.
Yeah, we share a lot of supplemental options, herbal things. And with any of these, the quality of what you utilize is going to be the most important. Herbal supplements tend to be sometimes contaminated with things like heavy metals. So we want to make sure that we're purchasing from reputable companies that are testing for heavy metals. We want to make sure that they're at the therapeutic, like clinical dosages that are actually going to be effective for some of these strategies that we're talking about. And then we want to make sure that things like our omega-3 fatty acids that we're recommending, or maybe even curcuminoids, that they're in the best absorbable form for our body to be able to really absorb and utilize, and that they haven't gone rancid in things. You might have heard that before. before with omega-3s that can be really problematic in the omega-3 industry. So our favorite for any of these supplemental and herbal options is Fullscript. Fullscript is an online supplement dispensary that we can set you up with all these recommendations that provides you a discount as well. They have great shipping and they have all of these options available from all of the best companies that do third-party testing and that use the highest quality ingredients and also use them at dosages that are actually clinically effective, which is really hard to find in a lot of your consumer-based brands that you would get at the store on Amazon, places of that sort. So we're going to include the link to learn more and to set up an account. All you're going to have to do is just put in your name, your email address. Once you do so, you'll be able to see all of these options within our catalog. You can search for any of them that you want to learn more about. You can look for the different brand options that are available, and then you can add them to your recommended list of what you're taking and get them shipped straight from Fullscript headquarters right to your doorstep.
Yeah, and I love Fullscript on the clinician side of things because it makes it so much easier for the patient. While it's great to keep track of the supplements you're taking, but if you come in for a nutrition consultation and all of your supplements are already in your Fullscript account, it makes it much easier for individuals to not have to bring a long list of some of the supplements that they're taking. And it's an easy way for your dietitian or one of our doctors to send recommendations your way. One of the final touch points that we're going to discuss today, some lifestyle suggestions for individuals who are dealing with prostate issues. So I feel like we talk about this very often, just the importance of exercise, physical activity, while acutely or in the short term, higher intensity exercise can have somewhat of an inflammatory effect that's actually helpful for our body to adapt to. As a whole, more so chronically or long-term, exercise can help lower inflammation, especially if you're in kind of more of this acute stage of dealing with prostate issues. You might want to keep your exercise more the low to moderate intensity, especially if you're noticing pain, maybe when you're doing particular exercises, utilizing your core muscles. We don't often talk about it in the context of men's health, more so in the context of women's health, but men have pelvic floor muscles too, and these are all implicated in this region that we're talking about. So if it is an exercise that is causing you to activate your pelvic floor muscles, while it's probably very beneficial, it might take some time to get used to those kinds of exercises. Pelvic floor physical therapy is also a thing for men just as much as it is for women to really help strengthen, support your pelvic floor health. So that's always an option. We're happy to connect you with the practitioner. If you are a current patient of ours, we're always happy to refer to individuals who we think would be supportive for you. But overall, whether it's exercise, pelvic floor, physical therapy, either of these things can be very helpful, both to help lower inflammation as a whole and support prostate health from really the musculature that is at play.
Amazing. Well, thank you guys so much for tuning in to today's episode. We'll be back in 2 weeks with a brand new topic. If you haven't had a chance to go back and listen to our interview with Dr. Van Meter, he's such a wealth of knowledge on this subject. So we highly recommend it. Just going to provide you with a lot more context on a lot of the recommendations that we made today. And we'll see you back in 2 weeks for a brand new episode.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.